Extract 1, questions 1 to 12. You hear a nurse discussing a patient named Lucy Hill with a doctor. For questions 1 to 12, complete the notes with a word or short phrase. Good morning, Dr. Evans. I wanted to discuss a patient, Lucy Hill, who was admitted last night with ongoing symptoms that seem to have worsened over the past few months.
Morning, nurse. Can you provide a summary of her case?
Certainly. Lucy is 45 years old and has been experiencing symptoms for about 6 months. It started with shortness of breath during activities like climbing stairs or walking longer distances. At first, she thought it was just a result of not exercising enough, but the symptoms have progressively worsened.
I see. Did she report any other changes in her health?
Yes, about 3 months ago, she began experiencing extreme fatigue. She described it as feeling drained after even minimal effort, like doing light household chores or walking short distances. She said it was unusual for her, since she's typically active.
Fatigue and shortness of breath. Any other symptoms?
Yes, last month she developed persistent chest discomfort. She described the pain as a dull ache that becomes more intense with physical exertion. She also mentioned that lying flat at night made the pain worse, so she's been sleeping in an upright position for the past few weeks.
Did she report any swelling or other physical changes?
Yes, she noticed swelling in her ankles, particularly in the evenings after standing or walking for a long time. She thought it might be due to her sedentary job, but the swelling didn't go away with rest.
Does she have any relevant medical history?
She does. Lucy has a 5-year history of hypertension, and she was diagnosed with asthma as a teenager. She mentioned that both conditions have been relatively well controlled until now.
Has she experienced any pain radiating to other areas, like her back or buttocks?
No, she specifically denied pain radiating to those areas. She hasn't had any similar issues in the past either.
What investigations have been carried out so far?
Routine blood tests showed elevated cholesterol levels, and imaging studies revealed significant narrowing of her coronary arteries. Based on these findings, the initial impression is early-stage coronary artery disease.
That seems likely. Did she mention anything about her lifestyle that might contribute to her condition?
Yes, she admitted to leading a mostly sedentary lifestyle. She works in an office and spends long hours sitting at a desk. She also mentioned that she hasn't been mindful of her diet in recent years.
What's the plan for her treatment?
For now, she's been advised to avoid strenuous physical activities and monitor her symptoms closely. She has a follow-up appointment with a cardiologist next week to discuss a long-term management plan. This will likely include medication and lifestyle changes, like a healthier diet and regular exercise.
That's a sensible approach. It's important to address her risk factors early to prevent further complications.
Agreed. I'll ensure she gets the necessary support and education on managing her condition. Extract 2. You hear a nurse discussing a patient named John Peterson with a doctor. For questions 13 to 24, complete the notes with a word or short phrases.
John Peterson is 52 years old and has been dealing with hypertension for the past 2 years. About 4 months ago, he started noticing persistent pain in his hands and feet. The pain seems to be worse in the evenings, and he describes it as a burning sensation. He's also experiencing numbness, which makes it difficult for him to perform his regular tasks. His pain used to be manageable with over-the-counter pain relief, but unfortunately the effect has been temporary and wears off after a few weeks.
Has he had any other symptoms, such as fatigue or changes in his physical appearance?
Yes, he mentioned feeling extremely tired throughout the day, and his work is also becoming more difficult due to the pain. In addition to that, he's noticed some changes in his skin texture, especially on his feet. They seem drier and more prone to cracking, which is something he didn't experience before.
Interesting. What about his weight? Any changes there?
Yes, he mentioned that he's been gaining weight recently, although he's not sure why. It could be related to his reduced activity levels or the medications he's on.
That's something we need to keep an eye on. What about his occupation? Is his job affecting his condition?
He works as a construction worker, which involves a lot of physical labor. The pain has made it increasingly difficult for him to perform manual tasks, and he's concerned about how it will impact his job in the long term.
Has any treatment been recommended so far?
We started him on some medication to manage his pain, but we might need to explore other options. He's been advised to take regular breaks during the day and avoid excessive strain.
We could consider a course of physiotherapy to help with the pain and stiffness, but we should also discuss the possibility of a nerve conduction study to rule out any underlying nerve issues. John's apprehensive about this, though, as he's not sure it will help.
I'll make sure to discuss that with him. He's also thinking about seeking a second opinion, maybe from a specialist, to get more clarity on his condition.
Now look at question 25. You hear a doctor discussing a post-operative patient with the nurse. Now read the question.
Mr. Thompson underwent abdominal surgery yesterday afternoon. He's a 65-year-old male with a history of hypertension, but otherwise healthy. His vitals have been stable throughout the night, and he's alert and oriented this morning. He's been tolerating clear fluids well, so we can advance his diet to soft foods later today, if there are no complications. However, I want to stress that he should avoid any physical strain for the next week. His sutures are intact, but excessive movement could jeopardize the healing process. Make sure to assist him when he gets out of bed or moves around to prevent any pulling on the surgical site. Let's monitor his wound for any signs of redness, swelling, or discharge. Please let me know if you observe anything unusual.
Now look at question 26. You hear a nurse discussing a patient's care with a physiotherapist. Hi Claire, I wanted to discuss Mr. Rodriguez with you. He's recovering from knee surgery and is anxious about starting physiotherapy.
Thanks for letting me know. Recovery can be overwhelming for patients at first. We'll start with some light weight-bearing exercises to rebuild his strength.
Light weight bearing, is that safe already?
Absolutely. We'll proceed carefully, of course. For the first week, it's more about gentle movements, like walking short distances with assistance, to ensure the joint doesn't stiffen. Gradually, we'll increase walking sessions as his confidence and mobility improve.
That sounds manageable. Anything specific we should avoid?
He shouldn't do heavy lifting or overexert himself, and arm exercises are not a priority unless he needs them for mobility aids. Let's focus on improving his lower body strength for now.
Now look at question 27. You hear a doctor and a nurse discussing a patient's medication.
Dr. Patel, about Mrs. Carter. Her pain seems to be under control now. Do we continue with the same dose of painkillers?
Yes, but keep an eye on her response. She's on a moderate dose, and I'd like to know if it's providing consistent relief or if she's experiencing side effects.
I'll know any complaints she has. What about her other medications?
Let's review those tomorrow. Right now, her liver function looks fine and her blood sugar levels are stable. It's just the painkillers we need to monitor closely.
Question 28. You hear a senior nurse giving instructions to a junior nurse about a patient.
I need you to take over Mr. Clark's care for the evening shift. He had surgery 2 days ago and everything's going well so far.
Any specific concerns I should be aware of?
Yes, he's on IV antibiotics, so ensure the next dose is given exactly on schedule. That's critical for preventing infection. Also, his wound dressing needs to stay dry. Check it regularly for any signs of leakage.
Got it. And his fluids?
His fluid intake has been consistent today, so it's not a priority right now. Just keep an eye on it as part of the routine checks.
Question 29. You hear a physiotherapist discussing a patient's progress with their caregiver.
Mrs. Bennett, I wanted to talk about your husband's progress. He's been doing well in therapy, but we've noticed he's still struggling with balance, especially when walking on uneven surfaces.
Yes, I've noticed that too. What can we do about it?
We'll adjust his program to include more balance and coordination exercises. For now, there's no need to increase intensity. We want to avoid overexertion. He just needs consistent practice with the new exercises.
Should we come in more often?
Not necessarily. His current schedule is working well. Focus on practicing these exercises at home, and we'll reassess next week.
Question 30. You hear a doctor instructing a nurse about a patient with asthma.
Maria, I need you to keep a close eye on Mr. Andrews. His asthma is under control right now, but he's still experiencing mild wheezing.
Should we adjust his medication?
Not yet. He's using his inhaler as prescribed, and it's working well for now. What's most important is monitoring his oxygen saturation. If it drops below 94%, let me know immediately.
I'll keep a close watch. What about hydration?
That's important, but he's already drinking plenty of fluids, so no additional measures are needed there.
That is the end of Part B. Now look at Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31-42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. You will hear an interview with Dr. Emily Carter, a geneticist, discussing the challenges of diagnosing and treating rare genetic disorders.
You now have 90 seconds to read questions 31-36.
Welcome, Dr. Carter. Can you tell us why rare genetic disorders are often so difficult to diagnose?
Certainly. Rare genetic disorders often have symptoms that overlap with more common illnesses. For instance, a child with a rare disorder might present with developmental delays or unexplained seizures, which can be mistaken for other conditions. Additionally, the limited availability of genetic testing in many regions makes it hard to pinpoint the underlying cause.
That must be frustrating for both patients and healthcare providers. What are the current challenges in treating these disorders?
One major challenge is the lack of targeted treatments. For many rare disorders, we don't yet fully understand the mechanisms involved. Another issue is the high cost of therapies, especially gene therapies, which are showing promise but remain prohibitively expensive for many families.
Can you share a specific case that highlights these challenges?
Sure. One of my patients, a 6-year-old boy named Ethan, had been experiencing progressive muscle weakness. His parents went to multiple specialists before he was finally diagnosed with a rare genetic condition called Pompe disease. Unfortunately, by the time we started treatment, his condition had already advanced significantly.
What advancements are being made to improve outcomes for patients like Ethan?
Gene editing technologies, like CRISPR, are incredibly promising. They could allow us to correct genetic mutations at their source. There's also a growing push for newborn screening programs that include a wider range of genetic disorders. Early diagnosis can make a huge difference in managing these conditions effectively.
What role do you think governments and healthcare organizations play in addressing these issues?
Their role is crucial. They can invest in research to develop affordable treatments and support programs for early diagnosis. Collaboration between governments, research institutions, and pharmaceutical companies is essential to ensure equitable access to these life-saving therapies.
Thank you, Dr. Carter, for shedding light on this important topic.
My pleasure. Thank you for having me.
Extract 2. Questions 37 to 42. You hear a talk given by Dra. Anna Marshall, a public health researcher, about antibiotic resistance. You now have 90 seconds to read. Questions 37 to 42.
Dr. Marshall, could you begin by explaining why antibiotic resistance has become such a pressing issue?
Certainly. Antibiotic resistance occurs when bacteria evolve and become immune to the antibiotics designed to kill them. The problem has escalated due to overuse and misuse of antibiotics in both humans and animals. It's particularly worrying because it's happening faster than new antibiotics are being developed. A significant number of infections, such as urinary tract infections and pneumonia, are becoming harder to treat.
What role do healthcare practices play in addressing this issue?
A large role. For instance, prescribing antibiotics only when absolutely necessary can slow the development of resistance. That said, it's not just about healthcare professionals. Public awareness is equally important. A common misconception is that antibiotics can treat viral infections like colds and flu, which is simply not true.
Is this a global issue, or is it more severe in certain regions?
It's a global crisis, but lower-income countries face unique challenges due to limited access to proper healthcare and regulation. For example, antibiotics can often be purchased over the counter without a prescription, leading to widespread misuse.
Are there any success stories in combating antibiotic resistance?
Absolutely. In Scandinavian countries, strict regulations on antibiotic use in agriculture have significantly reduced resistance. Additionally, public health campaigns in countries like the UK and Australia have led to a measurable decline in unnecessary prescriptions.
Looking ahead, what strategies do you think will be most effective in combating this crisis?
Developing new antibiotics is critical, of course, but we also need alternative approaches. For example, bacteriophage therapy, which uses viruses to target bacteria, is showing promise. Also, improving global monitoring systems to track resistance patterns can guide better decision-making.